Hello, everyone. Good morning. I'm Dr. Sharmin Kamroon. I'm one of the Child Adolescent Psychiatry Fellows working at UW, University of Washington at Seattle Children's. Little bit background about me. I was born and raised in Bangladesh, and I went to medical school there. I worked as a pediatrician for a couple of years there. Then I moved to United States, did my residency in New York, and I'm an aspiring child adolescent psychiatrist. So yes, now I'm here. And today, me and my colleague, Dr. Jordan, we are here to present something which is very important. Most of the time, our parents they like to know about this topic a lot. So we'll be presenting something about navigating mealtime challenges, what to do when your child won't eat. So I will pass it on to Dr. Jordan. Hey, Jordan, can you please introduce yourself and go ahead with the presentation?
Hello, my name is Dr. Jordan Veda. I'm one of the child and adolescent psychiatry doctors. So I did my adult psychiatry training at Northwestern University Hospital in Chicago, and now I'm here at Seattle Children's Hospital doing my training in child and adolescent psychiatry. And so we can go ahead and get started with our presentation today. Next slide. And so we have a few goals. What we want to do today is to understand normal eating patterns for children from infancy through the first few years of life. We also want to talk about healthy eating habits and ideas for supporting healthy eating habits. We also want to think about red flags, so areas of concern that are signs that it would be good to talk to your pediatrician. And then we will also have a section where we talk about specific tips, techniques, strategies that can help when your child is struggling with eating. And then finally, we will share with you a slide, one page that shows some links, some internet links that you can use to get more information about how to help your child eat. Next slide. And so what we want to start with is this section on typical eating patterns. So that means we'll first talk about sort of the normal, the usual, what happens when children are born, how they eat in the first few years of life. The most important thing to remember is that everyone is a little different. And so some babies, some toddlers, children are a little different in terms of when they make the changes in their diet and their feeding. But what we're going to talk about is sort of the general average, and it's all based on the best experts and research that we were able to find. Next slide. And so in terms of typical eating patterns, developmental and physiological reasons why eating patterns may change. And so one thing to always remember is that growth does slow down after ages 2 to 3. And so appetite can naturally decrease. A child may not be hungry at your regular mealtime if they have been snacking or eating during the day, so that can happen. And then sometimes a child will not be hungry, not want to eat just because they're very tired or they're just overstimulated and just can't focus on eating. So these are just general reasons. Another example of why a child may not be interested in a new food or eating could be things like texture, taste. And so, how a new food tastes, how it feels in their mouth, maybe that is a reason why they're not interested in that new food. And the general word that we use is called neophobia, and that just means that the child has a fear, is not interested in the new food. That's really common in toddlers. And another expression is food jag. A food jag means that a child was eating, they did eat the food, and then suddenly they rejected. So that's just another expression that we wanted to share with you. Next slide. And so, again, there are different reasons why someone may not, a child may not be eating, and some general tips, things to think about, you know, creating pressure, pressuring the child to eat can often lead to fights, power struggles. It can backfire. Um, Distractions like screens or toys during meals sometimes can make it harder to focus on food, harder to eat. And another important thing to remember is that what you do as a parent is very important. So children mimic, they imitate, they repeat what they see their parents do. And so another thing that can be helpful is just to remember that how you eat, what your children see you do, would be very important for them. Next slide. This is a chart that we wanted to share with you. On the left side, you will see ages in months. So, for example, 6 to 9 months, then 9 to 12 months, then 12 to 18 months, then 24 to 36 months, and then finally the last row, 36 plus, so 36 months and older, so 3 years or more. And on the right side, you see general patterns, what children generally do. And again, the main thing to remember is that every child is different. And so these are the general patterns or what children generally do. And so, just for example, the first row, 6 to 9 months, a child will be able, that infant who's 6 months old to 9 months old, they will be able to use both hands when they hold a bottle, and they will start finger feeding, meaning they will pick up food with their fingers and put it in their mouth. And so that's a general pattern that we see in children from 6 to 9 months. And then when you look at the rest of this chart, it will give you basic ideas of what to expect. And this is also a chance for you to think about, if your child is older than this, do you remember what they were doing when they were 6 to 9 months old? Do you remember what they were doing, for example, when they were 9 to 12 months old? And so this can be a way for you to think about your own child and compare and see how they were doing. Next slide. And this is just more information, sort of based on that chart, looking at more details. And so this first page is for infants. And so that means from birth to 1 year old, 12 months. And again, this just gives you basic information about what happens for feeding, eating when a baby is born. They usually will start solid food around 6 months, and then you'll notice from 9 to 12 months, that's when they start finger feeding, which means they will pick up food with their fingers, put it in their mouth, they will start drinking from a cup, and they will start chewing soft foods. Next slide. This is a slide that goes over toddlers, so 1 to 3 year old children. And here, what we see is that this is the age range, the age time where food neophobia, so that fear of new foods, that really shows up during the toddler years. And so it's very common for toddlers to have a fear of new foods, and they may have strong preferences. They may even reject or not want food that they used to like, and it can be a very messy time. Usually, as a toddler, children will start eating 3 meals a day, sometimes with some extra snacks during the day. And they will also begin to chew better, more effectively, and they will often begin to tolerate or accept different textures, different feelings in their mouth of food. Next slide. And so the next age is preschoolers. So children who are 3 years old up to 5 years old, we call preschoolers. And the main thing we want to emphasize here to remember is that even though preschoolers have more stable appetite, more stable, more regular eating patterns, there can still be a lot of changes, variability day to day. They can change. And so that's also very normal. And during this time as a preschooler, they are able to sit at the table for longer. They will begin to enjoy, the table, the social, the ability to share food at the table. They will begin to use a fork, spoon, utensils much better. They will use it well. And as they continue to experience and get new food, they begin to eat more different things. Next slide.
Okay, so now that we all know what are the typical patterns of eating across various ages, would like to bring your attention to the fact that the formation of healthy eating habits do not only mean that getting your kids to eat something or put something inside their mouth. So by the term itself, healthy means we want to foster an environment which is very positive and very friendly for your kids. And we want them to be able to build a long-lasting positive relationship with the foods. And what do we mean by that? That means that we'll try to do some of the strategies that will help them to be able to explore foods. We can teach them what food does to them overall, and we can also lead by example. That means our behavior, our eating pattern will kind of like model their behavior as well. So this leads us to the next slide, where we would like to focus on using more educational phrases to empower our children. Say, for example, rather than telling them what to eat, why don't we just teach them why we eat? Say, for example, I have 2 kids, and most of the time I struggle a lot, like offering them new and new foods. So my son, who likes to run, I asked them, do you know what the bunnies are good at? So he said, oh, they can run very fast, and I want to run like them. So then I asked, what does the bunny eat? He said, carrots. So then I kind of like told him, okay, so you want to run like a bunny. So bunny eats carrot, and carrots have vitamin A. So vitamin A helps their eyes to be very strong. So to kind of run fast, you have to have a very good eyesight. And well, you need some muscles to run really fast. What can you do? So you can eat some chicken. Say this, what does the chicken contain? So chicken contains protein, and protein helps us grow muscles. So we can use our, some of the things that we commonly see. We can just try to educate them in a very simpler way. I would recommend to be more and more creative. Use your imagination. You know your kids, what they like. Just, make up something so that help them to understand why we actually eat food. You can use some of the terms that we use. Say, for example, you can say, oh, your brain loves breakfast, or watermelon keeps your body cool and hydrated, or food is like a fuel, It helps your body run, play, and grow strong. And it is very important that we kind of like create some sort of awareness of their body, not to like force them. Give them some autonomy. So you can ask them, okay, do you feel hungry? What is your tummy telling you? Are you hungry or you're full right now? Or you can be more creative. You can say, hey, so do you think, can you please listen to your body? What does your body say? Are you ready for food? Okay. Or you can just give them option. You can say that, hey, you don't have to eat a lot. You don't have to finish all of them. Just try a small bite. Well, we can progress from a small mosquito bite. So say, for example, you can do some role playing. You can tell them, hey, do you know how does a mosquito bite? So why not we try from a mosquito bite? And then if they accept the food, then you can go further and further. Then you can say, ah, how do you know how a mouse bite? Um, then you can progress to a tiger bite, a giant tiger bite. So just take a small step. Every time, try to give them new food, like a small piece of food. You don't have to give a big chunk of food every time you offer, just a small. And if you don't serve, they will not get a chance to explore new foods. So I know that we sometimes see some parents, they kind of like they are kind of resistant to give foods to the kids for which they don't like, fearing that they are not gonna eat and the food will be wasted. But if we don't serve the food, we don't get a chance to expose them to new foods. That is something we need to bear in mind. And we also want them to explore more and more without putting any extra pressure on them. So maybe just we can offer them to just do a taste test. So we can say, what does this crunchy pepper remind you of? Or you can show them a broccoli saying, oh, what does this broccoli look like? Does it look like a tiny tree? Want to try a bite of the forest? So we can try in so many different ways. Just be creative. You know your kids, get new ideas and feel free to share with us. So the key point is we are not trying to force them to eat. We are not trying to put extra pressure. Rather, we are just trying to help them to explore new foods in a friendly environment. At the same time, we need to bear in mind that we are also modeling their behavior. And what do we mean by that? So say, for example, you're eating something new. You can just, say loud and say, hey, I'm just trying something new today. Sometimes it takes a few tries to like a food. So, trust me, your kids are observing you every time you eat something, every time you are doing something. So if you say that, it will kind of click in their mind also that, okay, maybe I don't like this food, but I can give it a few more tries to like it actually. And also, like whenever you try something good, say for example, salad, you can say, I love how this salad makes me feel energized. I noticed I feel better when I eat a rainbow of colors on my plate. So what we are trying to convey is that we don't want to label our kids. We don't want to be involved in shame or power struggles. There are certain things that we'll try to avoid because that kind of impact our kids' confidence. So it's better to avoid some of these phrases that commonly we use. You're being picky. You have to eat or you won't grow. Finish your plate or no dessert. Just try one more bite. You have to eat it or you can't just go out or play. Okay, so something like that. We will try our level best to avoid this kind of negative connotation because it really puts so much pressure on our kids. So I would like the audience to be more creative and let's take a pause for a few seconds and try to think and come up with ideas what we can do um, that will not need a lot of, you know, attention, that will not need a lot of time. I know we all are very busy, but all we have to do, we have to be just strategic. So, um, I mean, unfortunately, this is not an interactive session. This is a recorded session. So, yeah, but I would like our audience to think about different ideas, what can help to make the foods interesting. How can we involve our kids more into exploring new foods? Okay, these are the very simple ideas. Why not we make our foods more interesting? Use rainbow foods. Just sort out different colors of food, add it on their plate, make it more interesting. Say no to junk foods. And we'll go into details in our, next slides. Just wanted to give an overview what we are going to discuss. We can also involve them in prepping their own meals. Instead of storing unhealthy foods, we can store healthy foods at home. We can take them for pantry shopping. Whenever we go outside, we can eat together. We can help them modeling their behavior by showing how we are enjoying healthy foods. And yes, there should be a day when the kids get a chance to pick their own favorite foods. So I would like Jordan to continue the next slides.
So now we would like to talk about specific ideas or strategies to help your child when they may be struggling with eating. And these are all ideas that we want to present to help your child. And you'll notice the title Food Explorer. And so that's one way that we can think about children when they are struggling with food, when they are struggling to eat, thinking about them as a food explorer. Next slide. One idea is called reframe the narrative, and that means use different words, think about it in a different way. And so avoid labeling your child as picky. And so instead of thinking about them as picky, thinks and say they're still learning about new foods or we're exploring together. The words we use, influence us, they influence our children. And so it's always important to think about what are the words that we're using, what are more helpful words, more helpful ways of talking that will support our children as they explore new food. Next slide. Another idea is to remember the division of responsibility. So what that means is the parent has a job and the child has a job, and they're different. And the goal is to use this to reduce mealtime tension, which means to decrease tension, fighting over food, and to support and build up trust. And so the parent's job is to decide what, when, and where food is offered. And it's the child's job to decide whether and how much to eat. So this division of responsibility can support us in reducing that tension and helping support build trust. Next slide. Another idea is to help make foods, especially new foods, familiar. And so that means letting kids touch new foods, smell new foods, explore them without pressure to eat them. And so some ideas include almost making it like a game, taste tests, sensory bins, or putting different textures, different smells, different tastes together, making art with our food on our plate, using silly names, using different ways to make the food more familiar. And again, the goal is what is called exposure. Exposure means showing the child the new food. And so exposure without expectation, meaning showing the new food, presenting the new food, letting them touch it, smell it, explore it without pressure, without expectation, that will support the child becoming more comfortable with a new food. So making the food familiar. Next slide.
Okay, so another strategy can be getting involved in food prep. And what do we mean by that? So it's very important that we let them choose the veggies in the store. So as we mentioned, if you remember those strategies that we discussed, uh, one of the strategies can be taking them to the grocery and select their own veggies in the store. And then you get back home, you involve them in preparing the foods, have them stir it or make the batter or plug their own meals. Give them some ownership that will kind of trigger their curiosity and willingness to try new foods. And make the foods safe. And what do we mean by that? So offer safe foods. That means that to give them something that they are familiar with and they kind of prefer alongside the new ones. And the new ones, the new food, again, we don't have to give them a big chunk of food. We can just give them a small little portion without making any comment. And it's okay if they don't eat on the first day, but still we need to continue to offer them so that if we don't serve, that means that they're not going to explore at all. So maybe every day, try to get something new on top of their preferred food. In that way, we can expose them to more and more new foods. And they, at one point, they will start exploring them. And who knows, they will start eating them. And when they're trying something new, we need to praise them a lot. So not just saying, like using general terms like, oh, good job doing that, good job eating this. Rather, we can make it very personalized. Be enthusiastic, show some enthusiasm when you are praising them. Say them, oh, great, you did a good job. You are so brave, you tried something new today. Or your taste buds are growing very stronger. So show some enthusiasm and then they will also feel the same, just like you. And we have to bear in mind that not all kids are same. Some kids may actually have some sensory issues, and they do not necessarily reflect any kind of medical or psychiatric illness. They're just very much sensitive to certain textures, to some smells, or maybe, the taste of it. What we can do in those cases? Well, we can offer them different kind of textures. Say, for example, when we offer them carrots, like raw carrots, they may not accept it. Maybe it's too hard, or they don't like the smell, they don't like the taste. So then we should not avoid offering them carrots. Instead, we can try a different texture. So we can try a steamed carrot, or we can make them into small pieces so that it's not very hard and it's good, it's very easy to chew. So it's not encouraged to overwhelm them with a lot of combinations. So we'll try one texture at a time. Well, the key point, the take-home message is we need to be patient and very consistent. There are evidences that showed that it requires at least 10 to 15 exposures to actually accept a new food for the children. So every time we expose them in many different ways that we discussed already, it will foster curiosity over time. You just need to wait without keeping any extra pressure on them. And the bonus point is use food as a teaching tool. Just be creative. Let them know what the food's gonna make them feel or how they are gonna help them grow. Say, for example, you can say, talk about yogurt. You can say, this yogurt helps your tummy stay happy. Or spinach. Spinach gives your body superhero strength. And rice gives you a lot of energy to run and play. So just use the food. Again, be creative, come up with a lot of new ideas, and feel free to share with us as well. We need to bear in mind that there are some changes in the food habits that happen across various ages, which are due to normal developmental and physiological reasons. My colleague already mentioned that growth kind of like slows down during toddler age. And as they become preschooler, the appetite kind of like gets stable and their appetite kind of gets better. However, there are some red flags that we need to be aware of. So if you find your child is too tired or overstimulated, not being able to focus in eating, losing weight, like you know your child better. So if you find or if your gut says something is wrong, then bring it up to the pediatricians. If they're eating less than usual for many days, or they're just eating very few foods, then it's always encouraged that you bring it up to the pediatricians because it may signal some of the other medical or psychological conditions. It can be due to constipation, it can be acid reflux or some other illness that can reduce appetite. It can be some anxiety or sensory processing disorders. We commonly see those in children with autism spectrum disorders, but it can be separate entity also, like it can be only some sensory processing disorders also. And some other feeding disorders like RFID may also be involved in more persistent cases. So what is more important that always listen to your gut. If you feel like your children are not growing, there is something wrong, keep bringing it up to your child's pediatrician. Let them know. So there are some children who are very selective and they suffer from sensory issues. So those can be taken care of easily with the help of occupational therapy, which is very accessible, not a big problem. But again, listen to your gut. You know your children better. And if you have any question anytime, I know this is a recorded session. Unfortunately, we cannot take any questions, but if you have any question, you can get back to Miss Laura Lee and Dr. Fry. Yeah, and send us if you have any new ideas that can help children to explore new foods and get better. And this kind of like brings us to the end of the presentation. The next slide kind of shows some useful links that you can use if you want to dig more and know more about what are the reasons why children commonly refuse to eat and what are some of the strategies you can adopt to make them eat better. So Jordan, do you want to add anything? Do you have any last moment comment?
Yeah, so this last slide is the resources, some suggestions if you want to read more about it, if you want to learn more about how to support your child and their eating, especially if you are finding challenges or struggles with your child and eating. These are good resources that we looked at and that we would recommend. And again, we always encourage if you have questions, if you're worried about your child, the best thing to do is always make an appointment with your pediatrician and talk to your child's doctor. And with that, we want to thank you for your time and wish you all the best as you continue to support your child and as you continue to be the person in your child's life who helps them eat the rainbow.